My name is Dr. Vijay Patil and I will be talking to you about the overview of treatment of locally advanced lung cancer. So, today when you look at locally advanced lung cancer, once you have done the diagnosis, the treatment of locally advanced lung cancer is best decided in a multidisciplinary team. A multidisciplinary team is a team of doctors who take care of, who have from the different specialties like surgery, radiation, medical oncology, palliative, radiology, pathology, molecular, dietitian, physiotherapy and social workers. A team of all these members decides your plan. This planning takes into account multiple factors: the age of the patient, the mutation analysis of the patient, the PD-L1 scores of the patient, the comorbidities of the patient, and importantly the performance status of the patient. Taking into account all these factors and the expectation of the patients, we can have broadly two plans. We need to give these patients local therapy. We also need to give these patients systemic therapy. The local therapy can either be radiation based or can be surgical based. So how do you decide? Both of these therapies are shown to be equivalent. So if you patient intends to do for a non-surgical treatment. So today the treatment for locally advanced lung cancers who are fit enough to undergo radiation is chemo and radiation, which is a combination of chemotherapy given along with radiation. The radiation here goes on for roughly around 5 to 6 weeks, is given daily from Monday to Friday, Saturday, Sunday is an off. The chemotherapy schedules which can be used along with radiation can be of two types. They can either be 3 weekly or can be weekly. Once you complete the radiation and chemotherapy, after 6 weeks or so, we would start you on a treatment of immunotherapy called durvalumab. It's a type of immunotherapy which needs to be given in these patients. The course is for around a year. So the complete treatment for patients who are not willing to undergo surgery is chemo and radiation given together, followed by 1 week course of durvalumab. If the patient is willing to undergo surgery, then the treatment in locally advanced lung cancers today is, and if they are mutation negative, is to do neoadjuvant chemotherapy with immunotherapy. So today we give chemotherapy and immunotherapy together to these patients for 3 to 4 cycles, and after that we take these patients for surgery. After the surgery has been done, depending upon what is the pathology report, you may offer more chemotherapy to the patient or radiation to the patients, or it might also be observation as is in majority of the patients. Both this treatment approach are parallel and have never got compared to one another, and both are equivalent treatment options or weapons in the hand of a oncology team, and any of them can be used. In case if the patient has mutations which are positive, especially EGFR or EGFR mutation, then the patient, if operable, can undergo upfront surgery. After that the patient receives chemotherapy, and then the patient can be put on a drug called EGFR TKI inhibitor. The most preferred option here is a drug called osimertinib for 3 years. When we look at these patients, we need to understand that this though remains a broad parameter, depending upon their lung function status, their age, their comorbidities, one of these plans has to be taken into consideration. We also need to understand that when we give this kind of therapy, a lot of side effects happen. So we need to give good supportive care to these patients, like we need to give good diet to the patient, a good physiotherapy to the patients. We need to take care of their infections which happen during these therapies, and we also need to take care of the support which they require, which is actually mental support which they require during these therapies, because these treatments have their own side effects and they are pretty long also. If we talk about prognosis of these patients, how well these patients do, it actually depends upon whether they are mutation positive or negative. Also it depends upon what is the PD-L1 scores. The prognosis can differ with respect to these factors, and it can range from anywhere where 5-year chances of doing well can range from 40% to 70%, depending upon in which category you belong to. So if you have a locally advanced lung cancer, what you need to do? If you have a locally advanced lung cancer, you need to see thoracic oncologist, either a surgical oncologist or a medical oncologist who specializes in lung cancer. and where a team approach is feasible, so that one of these options can be given to you. To know such informative information about lung cancer, be connected with us. Be a part of the Lung Connect lung support group programs, where you would get more such information in detail with respect to each and every aspect of lung cancer. It's important to have information, because if you have the correct information, it helps you in an appropriate decision making. If you have any queries, you can contact us on the Lung Connect website and we'll get back to you. Thank you.